Pain management in burns patients is complex because it involves both continuous background pain from the initial burns and then severe breakthrough pains seen during procedures like wound care. While opioids are the mainstay for background pain, they are often insufficient for procedural pain. Ketamine can be used for procedural pain as it provides profound analgesia and a dissociative state without causing respiratory depression, which is particularly advantageous for inhalation burns. Benzodiazepines like lorazepam are also effective adjuncts, primarily by reducing the anxiety that exacerbates pain perception. Urine output is a critical marker of perfusion and the adequacy of the fluid resuscitation that is being administered, with a target of 0.5 to 1 milliliter per kg per hour in adults and 1 milliliter per kg per hour in pediatric patients. Reduced urine output indicates hypovolemia. So what is the standard response? Is to increase the intravenous fluid rate by 10% to 20% and then reassess frequently to achieve the target. Continuing the same IV fluid administration rate when there's clear signs of reduced urine output actually leads to worsening of the organ dysfunction. However, if oliguria persists despite increased fluids and is accompanied by respiratory distress, you must suspect complications of the massive fluid resuscitation that is being administered. Therefore, further increasing the IV fluid administration will become harmful. The correct action is to slow or to stop the infusion, then quickly evaluate vital signs and continue monitoring the urine output closely. Oral nutrition started within 6 to 12 hours of the burns injury is the preferred method for patients who can tolerate oral feeding. It decreases the hypermetabolic response, it reduces the circulating catecholamines, and then it maintains the gut mucosal integrity, which helps to prevent bacterial translocation. Delaying nutrition is harmful. So total parenteral nutrition is reserved for cases where oral feeding may not be possible, and then it's also associated with a higher risk of infectious and metabolic complications.